So how can you determine what is pulmonary embolism, which are blood clots in your lungs, versus altitude sickness? Can you determine what to look for from pulmonary embolism and altitude sickness if you know you're healthy? You don't, unless you pay attention to your body, and also if you've experienced both and you can tell which is which. If you are experiencing any unusual signs or any symptoms of shortness of breath, chest pain, tachycardia, like fast heart rate, or anything unusual in your body during your hike, stop, abort your hike, take care of yourself, take care of yourself, seek immediate medical attention, tell anyone, and don't hesitate. So pulmonary embolism versus altitude sickness. So for pulmonary embolism, if you have risk factors, you would most likely develop pulmonary embolism. The risk factors include increased coagulopathy of the blood, the thinning or the clotting of your blood caused by trauma, malignancy, pregnancy, oral contraceptives, especially the ones that are estrogen containing, and if you have any clotting disorders. The second one is endothelial wall damage, caused by surgery, trauma, bee sting, or any other stings, or any bites like poison ivy or snake bites. And then the third one is arterial blood flow. If you're immobile, sedentary, you have a long flight or any travel, orthopedic surgery, and also pregnancy. Altitude sickness, it happens when you ascend too quickly and it's your first time ascending an elevation. So the pulmonary embolism signs and symptoms include fast heart rate, which is tachycardia, chest pain, shortness of breath, ability to breathe fast, shortness of breath, and also coughing up blood. For altitude sickness signs and symptoms, headaches, fatigue, loss of appetite, nausea, and sometimes vomiting, and then you have a fast heart rate, pin and needle sensations, swelling of your extremities. Altitude pulmonary edema, which is fluid in the lungs, you experience breathlessness with exertion, persistent dry cough. And then for the high altitude cerebral edema, which is fluid in your brain, you'll experience a weakness, which is lethargy, drowsiness, confusion, ataxia on tandem gait test, which is the imbalance of you walking, headache without relief, and then you feel numbness as well. An example incident regarding altitude sickness and pulmonary embolism, if that happens, approximately 30,000 people attempt to climb Mount Kilimanjaro every year, and on an average, the reported number of deaths is about 10 fatalities per year, and of course more for the other ones. While there are multiple climber deaths every year, the number of people that die on Kilimanjaro is nowhere as high as one would expect it to be. So many deaths are preventable with proper climbing techniques and equipment. So just be aware of both altitude sickness and pulmonary embolism, and it can be caused by any multiple reasons such as exhaustion and etc. Please be careful out there. Bring a Garmin satellite phone or any satellite phone, or bring a friend that you can hike with and trust, and make sure that both of you discuss wilderness awareness and be safety conscious before you hike. Make sure that you understand that the cardiovascular and the hemodynamic adjustments in your body that occur during exercise recovery are driven by very highly coordinated and controlled mechanism in your body. So make sure this happens to prevent cardiovascular instability. So plan wisely, listen to your body, and seek medical attention if you feel anything unusual. Thanks for watching. I'll see you guys in the next trail. Stay safe, everyone.
I've been flying from town to town, from London to Taiwan. I've been all around the globe trying to protect your soul.